Hi everyone, welcome back to the Dr. Sia channel. In today's video, we're going to be looking at the sixth most common mistake that ISTDP practitioners make, and possibly all other practitioners in all other therapies as well. But I'm an ISTDP practitioner, and so that's what I'm talking about here. So the sixth most common mistake would be assuming anxiety over fear. Let's get started. Now, what do I mean by assuming anxiety over fear? Many of you might even go, what is he even on about? When have I ever done that? What are we, what are we talking about? So, in short, what we need to do is we need to make sure that whenever our patient is talking to us, that we follow the attributions that our patient is making. So basically what I'm saying is, if a patient of yours is saying, yeah, I'm anxious, versus I am afraid, those two patients, or that patient, is not saying the same thing if they're saying I'm anxious versus if they say I'm afraid. And I know that I've made this mistake so many times, and it's such a subtle thing, but making a difference here can mean loads to the effectiveness of your therapy. When a patient is saying I am afraid of something, I am fearful of something, 90% of the time, you can be confident, and of course, with that confidence, check it with your patient, that fear alludes to that they are afraid of something outside of them, that they are afraid of some consequence, of some outcome, of some political, social, occupational, relational complications, which is why they use the word fear. Because as we know, in the earliest kind of readings of psychodynamic therapy, we know that Freud very much was interested in this idea of what is fear versus what is anxiety. Now, Freud kind of thought that biologically there might be different. Recent studies are showing that biologically there is no kind of real difference between anxiety and fear. Anyway, I digress. Either way, when in language we use the word fear, in my experience, 90% of the time, my patients are talking about something outside of them. When they use anxiety, they may or may not be alluding to the idea that there is something that comes from inside of them. Either way, we want to check. We have to check. We can't assume that because the patient said anxiety, that they now mean that they are aware of the idea that anxiety comes from inside and fear comes from outside. This is something that my supervisor used to tell me so many times, and all the people who I've ever trained with, all the videos that I've ever watched in ISTDP, anxiety is something from inside, but fear is about something from outside. Anxiety is about something from inside, but fear is about something from outside. And I've been told that so many times. But you know what? My patients don't seem to know that. My patients don't seem to know that if they use the word anxiety or use the fear, that it could be inside or outside. In fact, I'm finding that when my patients say they're afraid of something, they're fearful of something, it's 90% of the time it's something outside of them. And I'm finding that when they're saying that they're anxious about something, again, 70 to 80%, even 90% of the time, I don't really think there's a difference actually, they're referring to something outside of them. Patients are not aware of this subtle distinction that us psychologists have about anxiety being from inside and fear being from the outside. So if you kind of assume that just because your patient says that they're anxious, that means that, they're not actually fearful of something, or if they say that they're fearful, it means that they're not actually anxious about something, then you're going to get a lot of delays in your therapy that are unnecessary, and you're going to be attributing a lot of things that are not there. So what do we need to do? When a patient says that they're afraid of something, we need to double check with them. So do you mean that, you say you're afraid. Do you mean that kind of you're afraid that someone might do something to you or think some way about you or treat you in some way? And they might go, yeah, I'm afraid that if I get angry, my husband will leave me. Or I'm afraid that if I assert myself in my job, then I might get fired. What that patient is alluding to is two possible things there. That there is a problem with me and my inability to assert myself, or my boss is really too strict. You don't know by that statement, I'm afraid that if I assert myself that my boss might fire me. You don't know if the patient is attributing that to something within them or attributing that to their boss. So what you need to do in that point in time and go, okay, now do you believe that you need to kind of learn to assert yourself more? Or would it be better if we just find a way to change your boss? That's just one way that you could say that, right? Another thing could be, oh, it would seem that if your boss was different somehow, then you'd be better at assert yourself. Or you could say it's something along the lines of, oh, so if you could assert yourself better, then perhaps your boss wouldn't fire you. Either way, this is alluding to both something that goes internal in the direction and external in the direction, meaning that you're kind of telling the patient there are some things going on inside and there are some things going on outside. And you kind of allow the patient there to show you again what they're going to latch on to. So the patient might say, yeah, let's change my boss. Now you know they're not here to change themselves in this very moment, in this kind of 1 or 2 minutes that they're with you. Right now, they believe that if they change their boss, their lives will change. Or they might say, yeah, if only I could assert myself better, then my boss would listen. Okay, so now you know that what they've alluded to in terms of their anxiety perhaps comes from inside. But again, you can double check, you can confirm, you can say, all right, so it would seem that whatever is happening comes from inside of you. Is that correct? Yes, the patient might say, all right, would you like to look at that with me? Look at why you get anxious in situations where you need to assert yourself. Yes, and then off you go. So a key point here is to not assume that just because the patient says I'm anxious or says that I am afraid, that they are actually attributing it to something outside of them or inside of them. You need to check, and I have another video as well that talks a lot about externalization, and have a look at that one too because it kind of relates to this topic. But it's really important, and the way that you can do that is just double check with them or use some of those techniques that I showed you there before. I hope you enjoyed the video. Please remember to subscribe, please remember to like, and please remember to comment on these videos. I do read the comments, and I can see that it stirs up a lot of feelings in the people who watch as well. It's not easy to watch a video about 10 common mistakes. And look, I'm not in a position where I'm like, I've never made these mistakes. Look, these are kind of like my most 10 common mistakes too. So we're all in the same boat together. But ideally, through communication, through conversation, through dialogue, and through learning, we can kind of all get better at what we do to the benefit of our patients and, of course, to the benefit of ourselves because we won't burn out as easily and so on and so forth. Enjoying our job, enjoying what we do, actually feeling like we're good at what we do is really important. So anyway, thank you so much. I hope you enjoyed the video. I'll see you again for the next one. And the next topic is going to be not continuously checking for agreement. We need to keep checking for agreement all the time, and we're going to be talking about that in the next video. So I'll see you then.